Thank you for choosing SolRx Pharmacy Review Program. The purpose of our videos is to better prepare you for your qualifying Part 2 exam. You will now have the opportunity to watch a presentation which will provide you an orientation of the exams. Secondly, some videos that will showcase some scenarios, followed with a quick review by a pharmacist. Wishing you all the best for your exams. Thank you for taking the time to watch these videos. SolRx Pharmacy Review Program has created these videos to help candidates prepare for the qualifying exam Part 2. You are now going to watch a scenario followed by a quick review with the pharmacist.
Hi, my name is Julia. I'm the pharmacist on duty. How can I help you?
I wanted to know if Advil was the best thing for my son's fever.
Of course, and I'll help you answer that question. Just before I do, I'd like to ask you a few more questions about your son's medical history, just to make sure I can make the best recommendation.
Not a problem.
Okay. Just so you know, this is a private counseling area, so everything we discuss will be private and confidential.
That's greatly appreciated.
And so what did you say your son's name was?
John.
John. And how old is John?
He's 5 years old.
So can you tell me a little bit more about the fever?
When John woke up this morning, he was really warm. I tested his temperature with a thermometer, an oral one. It read 39 degrees.
That is quite warm. Has he had any other symptoms that can explain his fever?
He's tugged on his ear a lot within the last day.
Okay, so you think it might be a little bit of ear pain?
I suspect he's got a sore ear.
Okay. Any other symptoms? Any cough, any runny nose, anything like that?
No, there haven't been anything else.
Has John been traveling anywhere recently?
No, we haven't gone on any travels.
Okay. And does he have any other symptoms? Has he been coughing or wheezing with this fever?
No cough or wheeze, no.
Has he had any dental procedures in the last little while?
No, it's been a while since he's last been to the dentist.
And have you taken him to the doctor yet?
Not yet, no.
Not yet. Okay, so I'll make a recommendation very shortly, but before I do, I'd like to ask you a bit about his history. Does he take any other medications?
He's on 2 puffers.
2 puffers? Do you know which one?
The orange one and the blue one.
Okay, so that's most likely the Flovent and the Ventolin. Does he have asthma, or was it for a different indication?
He has mild asthma.
He has mild asthma. And is that asthma well controlled?
It seems so.
Okay, that's great to know. Does he take any other medications, anything without a prescription or any herbal product?
Oh, no.
No. And does John have any allergies?
He's allergic to sulfa.
To sulfa. And can you tell me what happened the last time he took some sulfa drugs?
He developed hives all over his body, and he experienced difficulty breathing.
Okay, so it sounds like a pretty severe reaction to the sulfa. So I'll make sure we have that in our system recorded to check for future medications that he gets a prescription for. Okay, so you said the asthma was well controlled otherwise.
That's correct.
Okay, and just a few questions about sometimes lifestyle can also affect medical conditions. Is he a very active boy? Does he play around a lot?
Yeah, he's active.
He's active. And is he in school?
Yes, he goes to school.
School. Okay, sounds good. If you don't mind, I'm just going to check my reference for a minute, and I'll get back to you very shortly. Okay, thank you for waiting. So just in this case, because John's had a fever and he's tugging on his ear, I think it'd be a really good decision to take him to see his doctor because I suspect there may be infection for which he may require antibiotics.
Okay.
In the meantime, I definitely can recommend something for the fever. However, given that John has asthma, sometimes medications like Advil are not the best choice because they can make his asthma a little bit more sensitive, so he may have a bit more difficulty breathing. So it doesn't happen in every child, but I think it might be safer to try a different product. So I can recommend taking something like Tylenol, and the chemical ingredient in that is acetaminophen. But Tylenol contains a medical ingredient called acetaminophen, and within the suspension here, it has 160 milligrams for each 5 ml. Based on different weights, we give different volumes to each child. Do you know how much John weighs?
20 kilograms.
20 kilograms, okay. So based on his weight, we would actually recommend giving 7.5 milliliters every 4 to 6 hours as needed. Does that sound okay?
That sounds good.
Okay. And with Tylenol, it's usually very well tolerated. We generally don't see any side effects. Very rarely it can cause an upset stomach, in which case you can give some food beforehand and then give the Tylenol afterwards.
Okay. Does it need to be shaken or stored in the fridge?
So usually, because it's a suspension, we have to shake it really well, and then you measure the 7.5 milliliters, and it's stored at room temperature. So in terms of the flavors, I mentioned there's cherry and grape. Would he prefer either
Cherry,
or?
I think.
Cherry, sounds good. And then also in terms of the management of the fever, some kids do better when you give them a tepid cloth to put it on their forehead, and drinking lots of fluids can also be another thing you can do to help with the fever management, just in the meantime until you go to the doctor.
Thank you.
And if you don't mind, I'd like to call you maybe tomorrow just to see if the doctor has made any recommendations, or if you come by earlier with a prescription for an antibiotic, we can discuss that at that time as well.
Okay, that'd be great. Thank you for your help.
In the over-the-counter recommendation station, the first step is to ensure privacy and confidentiality. The next step is to gather information about the current problem by asking open and closed-ended questions. Make sure to rule out red flags. It is very important to gather a complete medical history to help you quickly identify the problem. Effective use of references will help you find relevant information quickly. During the counseling, make sure to discuss drug counseling, counseling on the medical condition, self-care measures, and offer follow-up. The solution lies in proper and relevant information gathering. Asking the right question gives you the opportunity to identify red flags and make appropriate referrals. In this situation, it also gives you the opportunity to make the appropriate recommendation, for example, choosing Tylenol rather than Advil. As the candidate, I was also able to provide appropriate counseling by discussing the medication itself as well as offering some self-care measures. To fully solve the station, I also offered some monitoring parameters and offered follow-up to the patient.
Thank you for taking the time to watch these videos. SolRx Pharmacy Review Program has created these videos to help candidates prepare for the qualifying exam Part 2. You are now going to watch a scenario followed by a quick review with the pharmacist.
Hi, my name is Julie. I'm the pharmacist on duty. How can I help you?
I'm just here to pick up my medicine.
Sure, not a problem. Just to reassure you, everything we discuss is private and confidential, so everything stays between you and I. And before I give you your medication, I'd just like to ask you a few questions about your medical history to make sure it's the most appropriate medication for yourself. Is that okay?
Not a problem.
What was your name?
My name's Jessica Anderson.
Oh, okay, great. And I have your profile on file here. Is it okay if we review it together?
Not a problem.
Okay. So it says here that you are taking Lipitor 20 milligrams once a day. Is that correct?
Oh no, the doctor discontinued that. I was getting really bad muscle pain.
Oh, I'm sorry to hear about that. So we'll address that very shortly. Just before we get to that, are you taking any other medications?
Maalox?
Maalox? So
Yeah.
that's an over-the-counter medication, is that correct?
That's right. For acid?
For acid. And how often do you take that?
Maybe 3 or 4 times a week.
Oh, okay. That sounds good. Any other medications, any herbal products, any natural products, multivitamins?
No, nothing like that.
Okay. And also because lifestyle can affect the way your medicines work in your body, I'd like to ask you a few questions about that.
Okay.
Can you tell me about your alcohol consumption?
No, I don't drink.
You don't drink. What about caffeine consumption?
Also, I don't do that.
No. And what about exercise?
I try, but it's fairly infrequent.
Okay. And what about any smoking? Do you smoke at all?
Not a smoker.
No. Okay. Let me just record that. And sometimes in females, medicines can have different effects if women are of childbearing age. Is there any chance that you're pregnant or breastfeeding?
Oh, no.
No. Okay. Okay, so I do have your prescription ready for you. I'd like to review it with you if that's okay. So you've been prescribed Crestor 10 milligrams at bedtime. The chemical name for Crestor is rosuvastatin. And the doctor, like I mentioned, has suggested taking it at bedtime. So it's 1 tablet before going to bed. You can take it with or without food, it doesn't matter. However, sometimes it can cause a bit of an upset stomach. So if that happens, you can take it after taking some food.
Okay.
When you were taking the Lipitor, if you remember, there was a restriction on grapefruit juice because there was an interaction with grapefruit juice. That's not the case with Crestor. So just so you know, you can take it with or without grapefruit juice.
Okay.
Some other things in terms of side effects. So I know you had the muscle pain with the Lipitor. Generally, patients who have had muscle pain with Lipitor do a lot better when they switch to a different medicine within the same class. So Crestor should be okay, but unfortunately there's still a small chance that it can still cause muscle pain. So if that happens, I would suggest that you contact your doctor as soon as you can. There's also a very rare but important side effect that it can severely affect your muscles, in which case you may have dark or dark brown pee when you go to the washroom. So if that happens, I would advise you to call your doctor immediately.
Okay.
Like I mentioned, these are rare side effects, but it's just important for me to mention for you. Because it's the first time that you're taking the Crestor, there's always a small risk that there might be an allergy. It's not common, but just in case it happens, make sure to watch out for anything after the first dose, and you can either call us or call your doctor. And then you mentioned that you were taking the Maalox 3 or 4 times per week. So there's actually an interaction with Maalox and Crestor, the way it's absorbed. So it's still okay for you to take the Maalox. It's just important to space it out from when you take it compared to the Crestor. So there are also some lifestyle changes that you can make that can help make improvements in your cholesterol levels. You had mentioned that you don't exercise that much, so exercise can be a key component in improving your cholesterol. So if you can, maybe try adding in 20 to 30 minutes of exercise a few times per week to start off with. And then also diet is very key. So in terms of diet, I can actually refer you to a dietitian, and you can speak in further detail about ways to optimize your cholesterol levels. Is that okay?
That'd be great.
If it's okay with you, I'd like to maybe give you a call in a few days just to see how you're doing, that you're not having any more muscle pain, and then we can speak in about a month's time as well to see if there's been any improvement in your blood work.
Oh, that'd be great. Thank you.
Okay, have a great day. In the prescription counseling station, the first step is to ensure privacy and confidentiality. By obtaining a complete medical history, it is much easier to identify the problem. Effective use of references will help you gather information quickly and efficiently. During the counseling, make sure you talk about drug counseling, self-care measures, disease management, and follow-up. A minor drug-related problem in the station was the interaction between Crestor and Maalox. This emphasizes the need to obtain medical histories and ask important questions such as whether the patient takes any over-the-counter medications. Although the pharmacist may have great knowledge, without obtaining a medical history and obtaining key information such as over-the-counter medications, this station may not have been solved. Asking the appropriate questions allows you to identify the reason for which Lipitor is being discontinued. In this case, it is muscle pain. It also gives you the opportunity to compare 2 different medications within the same class, Lipitor and Crestor. Also, you have the opportunity to advise the patient on lifestyle changes such as diet and exercise to help you fully solve the station.
Thank you for taking the time to watch these videos. SolRx Pharmacy Review Program has created these videos to help candidates prepare for the qualifying exam Part 2. You are now going to watch a scenario followed by a quick review with the pharmacist. Hi Maria, I know you know me. I'm Kathy, your staff supervisor. How are you today?
I'm good. I'm new to the pharmacy, but I'm liking it already.
That's great. I've heard some really good things about you.
Thanks. I believe you wanted to talk to me. What was it about?
We're in a private counseling area, so just so you know, anything we say will be kept confidential.
Much appreciated.
What are you doing with your labels after you're done with them?
I garbage them.
Are you aware that we have a separate shredding bin?
I've seen them.
So what do you think you should do with your label? Throw it in the garbage or throw it in the shredding bin?
I'm not sure, because if we put everything in the shredder, isn't it more expensive for the pharmacy?
Well, let me tell you, Mary. All of the information on the labels are confidential. They have personal things like the patient's name, their address, what medications they're taking. It's very important that the pharmacy respects the right of the patient's information to be kept confidential. We have to ensure that no labels get put into the garbage. Then the information could become public, and that's compromising the patient's safety for confidentiality.
Okay, it all makes sense now. I'm sorry about what I've done up until now, and I promise to try harder in the future.
That's great to hear, Marie. I'm going to provide you with the pharmacy assistant's job functions. I'd really like it if you could go through it. If you have any questions, feel free to ask me.
Okay, thank you.
Do you have any suggestions on how we can prevent this error from occurring in the future?
Maybe we could issue a circular in the pharmacy about the protocol for disposing of labels with patient information.
That's a great idea. I'm also going to suggest to the team that we add information in the pharmacy assistant's manual about how to properly deal with this so that no other new staff members are misguided. Meanwhile, if you have any questions, feel free to contact me. I'm sure you're going to be a great asset to our pharmacy team, and I look forward to working with you in the future.
I'll try my best. Thank you.
Thanks, Maria. Have a great day.
In management situations, a critical part is to ask open-ended questions in order to gather information. Also, you need to understand the situation without any bias. The next step is to identify the problem. However, identifying the problem is only half the job done. Don't stop there. The next step is to find a solution, not only for the current problem, but also to prevent similar problems in the future.
Let's try and analyze this case as well. A very important point in this case is to ensure privacy and confidentiality. The key to solving this case is to ask open-ended questions, to find out what procedure the pharmacy assistant was following and what was wrong with it. The candidate in this case used something called the sandwich approach. She started off by praising the employee, and in between included some critical comments, and ended off on a positive note. In addition, like any good manager, she also looked at ways of preventing such errors in the future. She decided to communicate with the rest of the staff the correct procedure of disposing confidential information by sending out a memo. She also decided to include it in the training manual.
Thank you for taking the time to watch these videos. SolRx Pharmacy Review Program has created these videos to help candidates prepare for the qualifying exam Part 2. You are now going to watch a scenario followed by a quick review with the pharmacist. Hi, I'm Kathy. Are you here to learn about the Epipen?
Yes, I am.
What's your name?
Ashley Jones.
I want you to know that we're in our private counseling area and anything we talk about will be kept confidential.
That's great.
Is this Epipen for yourself?
Yes, it is.
And why are you using it?
Found out I'm allergic to peanuts.
Oh, I see. Give me a moment to just check my references, please.
Sure.
Thanks for your patience. First, let me explain the various parts of the Epipen. Once you remove the outer case, you'll see the actual device. There are two ends. One end is the blue cap for safety, and unless pulled off, it doesn't get activated. The other end is orange. This is where the needle will come out. The middle part is where the medication is held. Am I clear so far?
Yes.
Now I'm going to show you how to use the Epipen. As I mentioned earlier, you need to remove this blue cap when you have symptoms of a severe allergy. This would include shortness of breath, hives all over the body. By removing it, you've now activated the pen. Since it's an auto-injector, make sure that you don't touch the orange end once the cap is removed. Otherwise, you could inject it into the finger, and this could create complications. So the best thing is to hold it like this, with the small finger facing down. You're going to swing and jab the Epipen into the outer portion of your leg. Hold it there for about 10 seconds and massage the area. Through your clothing is okay. You want to make sure there's nothing in your pockets, though, that's going to obstruct the needle from penetrating. Once you remove it, you want to look and ensure that the orange portion has exceeded the needle. If you don't see this, that means you have to repeat the steps again. It's important that you note that this medication is a rescue medication. It's not a treatment. You have to ensure you call 911 right away. Did you have any questions?
No.
You need to make sure you give this to the paramedics to dispose of. You can't throw this in the garbage. Also, you need to keep an eye on the expiry date. You have to keep this pen with you at all times. In a purse is a good idea. Don't put it in the fridge. Any questions?
No, I understand.
I know I've given you a lot of information. I'm going to give you a pamphlet outlining what we've spoken about. If any questions come up, please feel free to contact us at any time. Thank you.
Okay, thank you.
To make the demonstration easy for yourself and the patient, a good technique is to break the demonstration into a few easy, simple steps. A good way to begin is to explain the different parts of the device and exactly what they do. As you begin, it's best to break the demonstration into 3 or 4 simple steps, and at the end of each step, ask the patient whether they understood. The candidate made the demonstration look very easy by explaining the different parts of the device and what they do. She did an excellent job in explaining how to use the device by breaking it down into 2 simple steps and addressing other minor issues. An additional point could have been to explain how to remove the safety cap. It must be pulled up vertically to ensure that the device does not break. Otherwise, the device would not be activated and you may be without medication. After each step, it's also a good technique to make sure to ask the patient whether they have understood each part. Additionally, at the end of the demonstration, it's always good to ask whether the patient would like to have any step repeated. And if you have the luxury of time, you can ask the patient to repeat the steps back to you to ensure they have understood.
Thank you for taking the time to watch these videos. SolRx Pharmacy Review Program has created these videos to help candidates prepare for the qualifying exam Part 2. You are now going to watch a scenario followed by a quick review with the pharmacist.
Hi, my name is Kathy. Are you here to learn how to use Ventolin?
Yes, I am.
Is it for you?
That's correct.
And your name is?
Sarah Anderson.
And what are you using the device for?
I have mild asthma.
Okay, sir, let me just check my references, and I'll be right with you.
No problem.
Okay, so before I show you how to use the Ventolin, I want to show you the parts. This is the dust cap, which covers the mouthpiece, and this is the plastic container, which covers the canister. The canister is what contains the medication. So before using the medication, you're going to shake the canister 5 times. Then you're going to uncap it. The first time that you use the medication, you need to prime it. So you're going to spray it into the air 4 times. Now the medication is ready to be used. You're going to hold the canister in an upright position. You're going to exhale as much as possible. Then you're going to put the mouthpiece in between your teeth and use your lips as a seal. As you push down to deliver the medication, you're going to inhale. Try and hold it up to 10 seconds, as long as you possibly can. After you've exhaled, if you require a second puff, wait about a half a minute before repeating the steps over again. And make sure to always replace the cap. And if you haven't used the device in 5 days, make sure to reprime the device. Any questions?
No,
I know it was a lot of information, so I'm going to provide you with this leaflet. Please read it over, and if you have any questions, feel free to contact us at any time. Thank you.
To make the demonstration easy for yourself and the patient, a good technique is to break the demonstration into a few easy, simple steps. As you begin, it's best to break the demonstration into 3 or 4 simple steps, and at the end of each step, ask the patient whether they understood. The candidate made the demonstration look very easy by explaining the different parts of the device and what they do. She also did a great job in explaining how to use the device, and especially focusing on the points of how long to hold each breath and when to use a second puff. An additional point that may have been included is why priming of the device is required. After each step, it's also a good technique to make sure to ask the patient whether they have understood each part. Additionally, at the end of the demonstration, it's always good to ask whether the patient would like to have any step repeated. And if you have the luxury of time, you can ask the patient to repeat the steps back to you to ensure they have understood.